we have the one, the only, Greg Riley, and he has some very good pet advice for us.
Our pet expert, Greg Riley, yes, and the one, the only Moppet, of course, the real true star of the show.
Yes.
The real true star of the show, indeed. So today's topic is going to be a little bit different because, there's some people from longtime viewers know that I like to talk about some things that are a little bit different. So for today's topic, we're going to be talking about the cranial cruciate ligament damage. Now, I've got a nice little diagram that Mr. John Black's going to throw up here for us. So what actually happens is it's more or less just like a sports injury, like that you see with basketball players or football players, and this happens with dogs, okay? So what happens is that you'll have micro tears within the cruciate ligament in between the tibia and the fibula, okay? That's going to be supporting the stifle joint, all right? And over time, these little micro tears eventually became a bigger tear and eventually will snap, more or less, that will require surgery. So, if you have a dog that's limping, that's holding a leg up for a prolonged period of time, maybe the leg is actually beginning to atrophy a little bit where the muscle is deteriorating, may not be a bad idea to have your veterinarian check that out to make sure that, one, if that's what it is, and two, whether or not your patient is going to be suitable to have surgery, to have it repaired.
Now, is this type of tear, is this more common in certain breeds or large dogs versus small dogs?
If you go to Dr. Google, there's going to be a lot of people that'll be saying, oh, it's going to be more common in, like, say, labs. But I've seen it in Chihuahuas. It could really happen in any breed. The biggest thing is that dogs that are going to be, say, more obese are going to be more prone to it, as opposed to a dog that's going to be, fit and trim, so to speak.
Okay.
But it can really happen to any breed of dog at any given time.
So if you notice your dog limping for a prolonged period of time, and you take them to the vet and they say, this is what happened,
Right.
Do they have to have surgery? Is this something that you guys recommend?
It really just depends. I think probably most veterinarians will advocate, say, rest and some medication, no running, no jumping, no playing for a while, and see if the dog can actually start putting weight back on the leg. If it's pretty bad with x-rays, or sometimes you can manipulate the joint where you could actually see the knee go back and forth, that's when it'll probably have surgery required.
Okay, and just kind of recap for people, what are some of the symptoms they should be looking out for if they think this happened?
The biggest thing is going to be limping, severe limping. You're going to be not wanting to hold or put any weight on that leg. There's going to be lameness, obviously, and some atrophy going on with the muscles in the back leg.
All right, and then we also have a number there for you right there if you have any questions for Greg Riley, and you want him just to maybe give you some advice if you're unsure if your dog has any of these symptoms and what you can do for your dog. If you have any questions, just give him a call. All right, as always, Greg, thank you for stopping by.
You.
Moppet, thank you for stopping by.